Only about 17% of people coming out of the incarceration system who have a substance use disorder are getting the treatment they need through Medicaid. One researcher tells me that the big problem is not getting them the treatment while they're still in the incarceration system. According to new data released from VCU, over 4,600 adults were released from county jails and state prisons in 2022. 85% of that population enrolled in Medicaid, but only 17% had gotten a diagnosis or treatment for substance use disorder, including opioid use.
Almost 80% of all Medicaid members with an opioid use disorder have been receiving medication-assisted treatment. But that's only about a fourth among those who were recently released from incarceration.
Dr. Peter Cunningham with VCU's Department of Health Policy says it's because of multiple barriers.
A lot of times they don't have a stable place to live. A lot of times there's a gap between when they're enrolling in Medicaid and when they can sort of get the right set of providers to initiate treatment.
Under federal law, Medicaid will only cover emergency situations for someone who is incarcerated. There are some alternative treatment options offered in some jails or prisons, like Chesterfield County Jail's HARP program. Based on the research, getting an inmate medication-based treatment through Medicaid while they're awaiting release could prevent overdoses or re-entry into a jail or prison.
Having them actively engaged in the treatment program before they're released can really minimize or at least greatly reduce that risk. And as you say, it's more proactive rather than reactive.
Now, Dr. Cunningham did say that some states have looked at pre-release treatment waivers to get people the treatment they need before they are released, but it's unclear where Virginia stands at this time. I did reach out to Virginia Medicaid for more information, and I have not heard back at this time. In Richmond, I'm Elizabeth Holmes, CBS 6 News.